This looks like it might actually be our busiest, crowdedest post-COVID moment yet. So, congratulations to everybody who came, and thank you to everybody who came. And it's good to see you all. So, my name is Gideon Orbach. I practice chiropractic here at the World of Wellness. Uh, um, I was with this group when it was the Weiner Wellness Center previously, and I was with this group when we were on the South Side, and it was the Pain Release Center. So I've been here for a while, and I've seen quite a lot, and I've had a chance to help quite a few people and meet quite a few people, and feel like I'm in the midst of a good run. I'm very proud of what it is that we as a collective do here. And at the risk of sounding a little arrogant, I'm also proud of what I do here. I take pride in my work, as does everybody else, which is why I think we have a pretty good team and we're lucky to have the group that we do. And we're lucky to have the patient population and the shoppers and the enthusiasts and the fan club that we do. But we always fight and work hard and strive to maintain that. So I want to make sure to highlight the people who work hard here and who may not necessarily be seen. Seated to my left is IT savant Phil, who's managing the technology. Behind the desk, for some reason, we have Mike Gallagher, one of the sales reps and nutritionist. We have Ashton, we have Courtney, and we have Madeline, who are relatively new to our group, but have earned their wings as far as I'm concerned. Dr. Ross is an outstanding young chiropractor who practices here. We have a very good team. We have a nutritionist named Alicia, who's also does some coaching. So we're in good shape. And as I see this crowd sitting here in front of me, I'm thrilled to see, like, in this post-COVID world, people are trickling back. But if you're watching on the internet, or if you're on our Facebook group, or you're in whatever platform I'm up on, and you're thinking to yourself, I wonder, or yes, you should come back. Yes, you should be here. Yes, we got plenty of stuff going on. But anyhow, as I mentioned, my name is Gideon Orbach. I practice chiropractic, and I'm also hold the certification of primary spinal practitioner from the University of Pittsburgh, the PSP program. And what that program was is the first of its kind in which physical therapists and chiropractors were in the same classroom collaborating, figuring out what can we do together to strengthen both of our professions, which are actually remarkably similar. That PSP program has evolved into something huge. The University of Pittsburgh is going to be the first research-based university to start a chiropractic school starting in the fall of 2025. Now, I've been in practice since 2001. When I was at the very beginning of my practice, patients would come in and they would say things like, "Well, my medical doctor told me not to be here, so don't tell him I'm here." I don't know your medical doctor. I'm not giving up your secrets. I'm not telling anybody anything, but no problem. Physical therapists would campaign against us left and right, saying how dangerous chiropractors are. And then there was a few years later, there started to be a tipping point, and every now and again, I'd get a call from a physical therapist who would say, "Hey, can you teach me some of those tricks? Can you teach me how to do some of your secret sauce?" Oh, I'm a big fan of collaborating and sharing information. I'm not really a big fan of total strangers who've campaigned against me trying to steal my good stuff. Anyway, so you guys know how powerful UPMC is. They're like the force behind Western Pennsylvania. They're one of the top medical programs in the country, probably in the world. Hit physical therapy year in and year out, ranked one of the top 1, 2, even 3 physical therapy programs in the country. That's kind of impressive to me, and all those people had to sign off and say, "Yep, chiropractic. They're not that bad after all. Let's start a program." That's my drop the microphone moment, but I'm gonna go on. I got a lot to say for myself. So, for anybody who's sitting here listening to me who's, been hesitant, for anybody who's out there in cyberland listening to my presentation as IT savant Phil works his magic so that you can hear and tune in, the University of Pittsburgh, one of the strongest, most powerful, most influential, most cutting edge, most research based institutions in the whole wide expanse. Their number one ranked physical therapy program decided we were evidence based. And not only are we okay, but they want to co opt us now. Makes me happy. All right. So, anyhow, what do I do here? I work one on one with patients. We hang out in my treatment room and we talk about your condition and we talk about the things that happen to get you that way. And then we talk about the things that, well, what do I find that's going on and what can I offer you and how can I help make this better? And I have a few tricks that I rely on. I do muscle release techniques. I do a combination of pressure point, trigger point release. For those of you that remember Andrea and Herman and Jacob and Adam, I'm by no means as comprehensive as those four people are, but I still do some pressure point, trigger point muscle release. I also do assisted stretching. That's a different form of muscle tendon tightness release. I do the stereotypical high velocity, low amplitude chiropractic adjusting to the spine and to the extremities. So, for people who have knee and ankle and shoulder complaints, and you're thinking to yourself, why would I see a chiropractor? Well, we do that here too. I like to do condition specific rehab, condition specific nutrition. If somebody has a systemic nutritional deficiency or a nutritional problem or a liver or digestive problem, I like to recommend that they see Alicia, our nutritionist. I know that there are a lot of people who work here who are heavily involved in nutrition, including some of the salespeople with Nutritional Frontiers who are well versed in our protocols and the Nutritional Frontiers protocols. We have people who are trained to look at people's nutritional issues from head to toe and take note of their deficits, and we're able to help them. I'm more like if you roll your ankle and it swells, I can help you get started with nutritionally speaking. Let's lubricate those joints. Let's consume supplements that will help release tight muscles. Let's consume nutrition that will reduce and even prevent future inflammatory escapes. So I'm highly, highly condition specific. And we have people here who do head to toe multi organ system nutrition. So far, so good. Okay, the reason I asked so far so good, you guys, if you're sitting here live in the audience and you have questions, you're more than welcome to throw them at me. If you're in Facebook land or YouTube world or anywhere else tuning in virtually, and there's something that I say that's ambiguous or not clear, or you want to drill down on, type them into the margin. IT Savant Phil is going to help me by poking me from more than an arm's reach away and letting me know that their questions, comments, moral outrages, all are welcome. So the other thing that I do here is low tech rehab. Low tech rehab means exercise without equipment, or maybe we'll use really sophisticated equipment for some moves like a shower towel or can of soup, maybe some ice. It's about this time that I make some sort of a bad joke that I've overplayed where if you don't have any ice, we can give you the recipe. Anyway, before moving on, I would like to do some low tech rehab with all of you. So if you're sitting here tuning in to me, we're going to do a little exercise. We're going to do a posture exercise together for starters. So what I want is for everybody to sit up as straight and tall as they possibly can. And I want you to think about the section of your body that lives between your belt buckle and the bottom of your chest, the top of your abdomen. So we got this area. And what we're going to do is we're going to make ourselves as long and as tall as possible in this area. And we're just going to kind of lift the bottom of our chest up, which should naturally throw our shoulders back. We're not shrugging our shoulders up to our ears. We're just rolling our shoulders back, and we're creating length sitting in here between our belt buckle and the bottom of our chest. So if you're sitting there listening to me, we're doing some positional release, kind of core strengthening, holding ourselves in the position that we really ought to be in. And we're just going to hold this and roll on with the show. And if you get fatigued from this position, Go ahead and relax into your chair, but we're still going to hold this and come back to it when you feel appropriate for yourself. And this is going to be a sign that here's something we really all ought to be working on for our postures. Shoulders are rolled back, enabling our chest to lift up, and we're long in our abdomen. We're tall in our abdomen. And so if you do that while you're standing, you'll find yourself leaning back slightly, slightly, and you'll feel your chest coming out slightly, slightly forward. So far, so good. So this is in my world, in my chiropractic practice, this is a rehab exercise. We get to the point where we're past rehab and it just becomes the way you sit and stand and carry yourself comfortably. Everybody cool with that? So I told you I do multiple forms of muscle release technique. I do skeletal adjusting throughout the spine and the extremities. We do these types of exercises to orient ourselves to better posture. We do condition specific rehab. And the $1 million question is why? Why would you want to do that? Why would you invest all those years in going to school and paying back student loans and working one on one with people to poke in their tight spots? Why would people want to be a chiropractic patient and have all these tight, tender spots pressed upon, twisted, torqued, maneuvered, whatever the word might be? Well, what we want to do is we want to inhibit nociceptors. There's my big time silver dollar word of the day, nociceptors. That's my topic. I can talk about nociceptors until the cows escape and come back. Nociceptors are neurological tissue in your body that signal the brain that there's a problem. The word nocere comes from the Latin to harm. So, first of all, let me compliment almost all of you who are still in that great long in your torso posture. We're still doing our exercise. So, nociceptors fire. They're tiny, 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 the smallest possible particle of neurological tissue that are going to send information from the body through the nerves into the spinal cord up to the brain to say there's a problem. So something has to trigger that nociceptor, right? I mean, it doesn't happen spontaneously. At least it shouldn't happen spontaneously. That makes sense, right? Right? If I nod my head right, that means the answer is yes. If I shake my head no, that means the answer is no. I told you at the very beginning, I don't like giving tests. I don't like taking tests. There are no trick questions. Nociceptors should not fire spontaneously, correct? Yes, correct. Sometimes they do, and that's a problem, and we're going to talk about that next, but they shouldn't. So, what is it that would trigger a nociceptor to get itself going and to start causing problems, telling the brain that there's a problem out here? Change of pH. We want to have a healthy, normal pH, which is scaled on a 14-point scale, and we want to be just slightly more alkaline, more basic than neutral, and we'll call neutral 7. So if we're like 7.2 ish, that would be a pretty good place to be. Would you say, Joe Messino? Yeah, right. If we're 7.00002, that wouldn't be so bad, would it? No, not at all. If we're 6.999998, uh, uh, anyway. So if we have a change of pH shifting us towards acidic, nociceptors will start to activate. They will send messages through the nerves to the spinal cord and up to the brain saying, problem. So let's drill down on that for a very split second. A change of pH. If we wanted to alkalinize ourselves, if we were worried about, like, I think I'm getting too acidic, how would I get too acidic? Well, one way for certain is a poor diet. I think every single one of us who eats that standard American diet, Western world stuff has a moment here and there, at least, of a little too much acid in their food. Myself included, I'm guilty too. So we should be thinking about strategies to use chemistry to fight chemistry. We've had an acid problem. So let's think about something that we could do that will alkalinize our system or help us shift that way. I think the lean greens from Nutritional Frontiers would be a a very reasonable selection. If you're going to pick one item and one item only, a green superfood would do the trick. Shameless plug for the product coming from yours truly, Lean Greens, Nutritional Frontiers. If you're not taking it, put it on your checklist. Ask yourself, by taking this, will I be doing myself a service? The answer is probably yes, depending on what others are taking. And kudos to the company. There's also chocolate flavored greens. I can't wrap my head around the chocolate flavored greens, but it is tasty. What else would activate a nociceptor? Well, pressure. If you put pressure on a body part, you might very well depolarize or activate the nociceptor. As I stand here and talk to you, I have the palm of my right hand resting on the little table. I have my left palm wrapped around my right wrist. I'm leaning a fraction of my body weight into it. If I stand here long enough, I will probably activate some nociceptors in my hand. And when I'm done, maybe I'll feel like, oh, my hand, well, I had my hand fall asleep. What happened here? How many of you have had the experience of I wake up in the middle of the night and my hands or my feet are asleep? I wonder what kind of body position or what kind of sleep yoga you've been doing to put your hands or your feet under too many blankets, under another body part, under the pillow. We can talk about more of that later. So the nociceptive population is triggered by pressure. What else will trigger a nociceptor? Well, a deficit of oxygen. If you find yourself gasping for air, short of breath, you're probably activating nociceptive populations within your body, which brings us to a great point in the workshop to do some more low tech rehab. Let's reassume that position. I see that some of you have been there all along and some of you have fatigued. And if you fatigued, that's a sign that you should probably do more of this and strengthen these muscles to hold yourself in this posture. If you're still at it, it means you haven't reached your fatigue point yet. Good for you. Everybody's got one, though. So let's come back to this point where we're long in our torso. We've thrown our shoulders back. We've pushed our chest mildly forward. We're tall from our belt buckle to the bottom of our chest. And what we're going to do is we're going to take a deep breath in through our noses, and we're going to feel all of this expanding outward like I mean, when you watch these athletes and they jump up and they give themselves whole torso high fives and they bump their chests into each other in midair. Looks kind of silly, but it's good for the sake of our conversation. I want all of you to think about where you're sitting. I want you to give me a high five with your chests. So we're inhaling through our noses, pushing our chests out without bringing our shoulders up. And we're going to hold this position for 1,001, 1,002, 1,003. And let's blow out through our mouths and let's return to our normal chest posture, but that long, tall posture that we're going to be working to grow accustomed to. One more time. Big, deep breath in through your nose. Everything is expanding. We're still long in our torso, but we're long in our abdomen, but we're expanded out this way. Our shoulders are still back. They're not shrugged up. Hold for another 1,001, 2, and blow out through your mouths. Let's do this again. Deep breath in through your nose. Staying long in the abdomen. Inhaling, becoming big in your chest, absorbing as much delicious oxygen as you possibly can, holding it for another split second, and out through your mouths. How are we doing with people in the cyber world? Questions, comments, moral outrages? How are we doing with people live? Questions, comments, moral outrages? I got a thumbs up in the back. That makes me happy. Anybody else? All right, let me ask you guys a question. When you took these couple, 3 deep breaths, did you feel lightheaded, fatigued, energized, lightheaded? Probably a sign. Probably a sign that your nervous system is just simply not used to getting that much oxygen in as efficiently as you have. And you're going to have to teach yourself how to adapt to being a more efficient person. Pretty cool stuff. Were you going to say something? Okay. I thought I saw you straighten up like you were going to talk, and maybe it was just through the wires of the camera, and it's my fault. All right. So we just did 3 deep breaths. I wasn't really keeping track, but I'll bet you it was in the neighborhood of the 30 to 45-second range that we're really moving slowly, deliberately, sucking in as much delicious oxygen as we possibly can. Because remember, in an environment that's oxygen deficient, we're triggering the activation of nociceptors, and those nociceptors are going to tell our brain that there's a problem, right? So I used to, in a pre-COVID world, we'd have everybody prick their finger and then would sign a little drop of blood, promising to do all the exercises that I suggested for them. But we got to grow with the times. There'll be no more blood pricking. In fact, I don't hate tests. I, I don't like giving them. I don't like receiving them. I just like to put forth information and hope you'll follow along. So let's drill down on this for a second. The textbook normal says we should all be breathing about 12 to 20 times in a minute. At 12, that sounds like a really nice, relaxed pace. At 20, that sounds like we're probably hyperventilating. 3 seconds between like that doesn't sound too cool. Now, one of the things I like to look for when I examine a new patient, when we first get started, like we're at day one and we're talking about what's going on with you. Okay, did you fall? Did you have an accident? How long has this been going on? And then we question and answer, and we figure that out. Now it's time for me to start examining somebody and making sure that the physical presentation and the story are a match, and there's no underlying emergency like, this leg really hurts. Well, how do we know that that's not a symptom of a blood clot that could be fatal? You don't belong in the chiropractor's office. It's my job to find out what's going on and make sure that you're in the right place before we take any action. That being said, one of the things I like to do very early in my physical exam with people is I just have my hands resting across the bottom and front of their neck and maybe the top of their shoulders, and I'm feeling their rib cage rise and fall as they breathe. And I'm probably not, unless I find something really out of the ordinary, I'm not. All right. For the people who are here live, I think you just heard what happened. For the people who are in cyberland, something very cool just happened. A grown man with an enviable, an enviable amount of knowledge crammed into that cranium of his. In fact, sometimes we follow him along in the hallways and he doesn't know this because we're hoping he'll like drop a little piece of knowledge and we'll have a mad scramble and somebody will pick it up and claim it. Just had an aha moment. So as I said, when I start with a patient, I rest my hands on their, right here on the top of their rib cage. It might be the trapezius muscle, it might be the scalene muscles. It depends on that individual person's anatomy. I'm just simply feeling the rib cage rise and fall as they're breathing. And I'm not staying there for a full minute, but I'm certainly there long enough to get a sense of, is this rhythmic? Is it symmetrical? Is it, oh, there's a problem. Let me look at my watch and live here just a little bit longer. Okay. So that oxygen rate. So I'm big on with new patients, really counting it, with established patients, just getting a ballpark gist of it. And I got to tell you, there are a lot of people out there breathing at a rate greater than 20 breaths per minute. There are not a lot of people out there breathing at closer to that 12 breath per minute rate. And then I tell you, a lot of people, I'm telling you, based on my experience, based on my patient population, and let's be honest here, it's hard to be a chiropractic patient. You have to show up. This is you bet on yourself time. You have to brave that Pittsburgh traffic. I'm sorry. You have to get here relatively on time because I'm kind of booked up and juggling people's time slots and trying to make it happen for everybody who's on the list as close to their time as possible. You got to take time out of your day to be here. And I hold my patients in a very high level of esteem because I know they've made that commitment to get there on that particular day at that particular time. But this is bet on you time. You want to do this, you got to bet on yourself and show up for yourself, because myself, Alicia, Dr. Ross, IT Savant Phil, Madeline Ashton, and Courtney, they bet on you. They came, they showed up for work today. We all showed up. So we want you to bet on yourself and keep your appointments and make appointments. But that being said, my population of people is small when you consider who's out there in Pittsburgh, who's out there in the region, who's out there in the country. And when I tell you that these people who have bet on themselves, who've made the commitment to come here and get a treatment and to be evaluated and to talk about their systemic well-being and how their bodies are working and what they can do and what we can do and so forth, that group of people is breathing 20, 24 times a minute. Oh no, what's everybody else doing? What are the people who don't bet on themselves doing? There's a Burger King right over my left shoulder. I bet you their lot's full. Anyhow, that all being said, I can't emphasize for you how important it is to do these deep breathing exercises and to train your body to be physically more efficient, more practical, breathing deeper, engaging your diaphragm with your deep breath, which you do when you're long in your abdomen and your torso is up and your shoulders are thrown back. And I'm breathing from here. I can give you all the chiropractic in the world. Believe me, I have some very cool tricks. I told you I had physical therapists calling me up wanting to learn my tricks. I have other chiropractors who want to learn my tricks. I'm the beneficiary of some outstanding mentorship. Every year or two, I go to a technique seminar looking for somebody who I really have respect for to watch me adjust a few people and say, hey, you got to tuck your elbow in a little bit more. Your knees aren't bent enough. Lean over further. That looks good. Tiger Woods has a swing coach. So we can do all the chiropractic in the world for you. And we can put together a wonderful, wonderful nutritional protocol catered to your individual specific needs, not what, oh, well, this is good for heartburn and you have heartburn. Let's drill down and figure out more in depth as to what you need, not what the product bio says. But if you're not breathing efficiently and deeply and getting enough oxygen in, we can only do so much. You've lowered your ceiling. So let's do this. Let's every single one of us raise our floor and raise our ceiling and become better deep breathers. So far, so good. Questions, comments, moral outrages? All right. So what else will activate the nociceptive system? What else is going to trigger this part of the nervous system that tells the brain, hey, we got a problem? Well, tissue destruction, a sprain strain injury, a traumatic impact injury, a slip and fall, a repetitive motion. If you like to go to the gym and lift weights and you decide today's the day I'm going to set a personal world record in the lift of my choice and I'm going to become Mr. Universe in my own little universe, you're probably going to have tissue destruction by straining yourself to lift more weight than you're accustomed to. So far, so good. So we can do some very healthy things. When people finish the marathon, when they've traversed 26.1 miles, 26.2 miles, 26.2, when they've gone 26.2 miles by foot as rapidly as they can over the cobblestones, over the hills, pounding the pavement, man, I respect their cardiovascular function. Those people, wow, what great endurance. Awesome. You don't think they're suffering biomechanical injuries and tissue destruction in their feet and their knees and their hips and their back? And probably if they pump their arms a little bit, actually, it's a smaller pump for a marathon. You don't think at a certain time you're going to have some repetitive overuse sprain strain injury in your elbows and your wrists running like that? Wow. Who'd have thunk it? Turns out running the marathon might be a declaration of profound health, but you're still doing yourself some harm and activating your nociceptive system. So far, so good? All right. Temperature, barometric pressure. big ones. That also will influence your nociceptive system and get those little subvisible neurological particles in motion, sending messages through the nerves, up through the spinal cord to the brain, indicating that there's a problem and there's destruction and there's irritation. So as it turns out, my brother and sister-in-law went to high school together, and they were a year apart, and they were on the outer edge of one another's circle of friends. So they knew who one another were, but they didn't really know each other. They were both with the State Department at the same time, and they were both in Tel Aviv at the same time, and they met at a Steeler bar in Tel Aviv. Yes, a Steeler bar in Tel Aviv. I have a very, very good friend, for all intents and purposes, one of those not biological brothers who I've known very well since elementary school, who now lives in Scottsdale, Arizona. I went out to visit him, and we went for lunch at a bar that was dead. It was like, we're the only people in here, and it was almost like they were sorry to see us. Like, now we got to work. And I said, "What are we doing?" He's like, "This is the Steeler bar. We have to patronize them during the off season." There's a Steeler bar in Tel Aviv. There's a Steeler bar in Scottsdale, Arizona. Hi, why did all those Pittsburghers go out to the Southwest? I've never been to Tel Aviv, but I've seen pictures. It's beautiful. IT Savant's been to a Steeler bar in Italy. Some people want to connect with their ethnicity homeland, and that's cool. Some people want to go live in a city that's a lot closer to the beach and the tropics than Pittsburgh is, and that's cool. Some people think the seasonal allergies and the barometric pressure and the temperature here is triggering them. They feel rotten in this rainy, dreary Pittsburgh weather, and they move to Phoenix area. They moved to Albuquerque area, and that's cool. They brought their Steeler bar with them to a place where the barometric pressure and the temperature did not offend their nociceptive system. You guys got how profound that is? My body aches so badly where I am that I need to pick my life up, uproot myself, and move to an environment where the barometric pressure or the temperature better suits my physical health. Wow. Man, you talk about drastic steps to inhibit the nociceptive. They got me beat. I didn't move anywhere for that. Anyhow, so we keep talking about these nociceptors and how they go to the brain. We have I got my pressure on my hand and a little bit of tissue destruction because I'm leaning in, making myself a little too comfortable, leaning at this table for probably about 35 minutes now. So I'm going to have this repetitive overuse, compression, pressure, tissue destruction as it the tissue warms up. I wouldn't be surprised if the tissue acidity changed a little bit, even locally underneath my hand. I got all these nociceptors in my palm traveling through my nerves to my spinal cord and then up to my brain. So what, right? I mean, it sounds like, hey, that's a great, great story to tell the game show hosts. What does it really mean? So approximately 2/3 of those nociceptors that flow up to my brain are going to go to my brain stem. They're going to cease and desist at my brain stem. But what happens at the brain stem? That's where, by and large, our sympathetic nervous system lives there. So we're triggering sympathetic nerves. So at the brain stem, that mediates your heart rate, your the motility in your digestive tract, um, your pupil dilation, your blood pressure, uh, um, your muscle tension. These are all gonna go on in your brainstem. So if I lead into this and I activate enough nociceptors, quantity, and that quantity comes to threshold, and it starts traveling through my body, like I could be in trouble once my brainstem gets activated. Now, between you, me, and the walls, I don't think this is enough to activate my sympathetic nervous system. But this stuff is additive. It's not just what's going on in my hand. It's the nociceptors that are firing because I sprained my ankle and because I twisted my knee and because I worked out pretty vigorously this morning and because I twisted myself a little bit awkwardly adjusting a patient this morning and because I feel like maybe I have a little bit of a headache. Hmm. I wonder if that's a product of the way my body is talking to the brain, to my brain, and my symptom is I'm a little bit headachy. Could be, absolutely could be. So that's 2/3 of the nociceptive population. What's the other third going to do? It's going to continue on its journey beyond the brainstem up to higher centers of the brain, maybe places where might end up in a place where we have cognitive thought. When have you ever been in pain? And I know everybody I'm talking to has been in pain at one point or another. Maybe it was short lived, maybe it's long lived, maybe it was an acute episode, maybe it was a for today and today only thing, maybe it's an on off chronic thing. I couldn't say. You all have your own individual experiences, but I know that I'm talking to a crowd that has experienced pain at one point or another. You don't think that that pain influences your thought, your attitude, the mood that you're in, the way you relate to other people? Nodding my head, yes. Not trying to hypnotize you and implant bad activity and bad mechanisms in your mind. I'm telling you about a very, very relatable concept. Okay. So I think, I think it's important to inhibit nociceptors, right? In fact, I think it is so important that I bet my whole career on it. So what I do, as I mentioned, I like to do muscle release techniques. We got the stretching of tight muscles, the pressure point on specific parts of tight muscles. The obvious question is, well, if you put pressure on the muscle, aren't you going to activate the nociceptor? Well, if you get it wrong, yes. If you find the right tight spot and the right trigger point, no. So we do pressure on tight muscles. We do stretching. We do adjustments to stimulate and move the skeleton at the spine levels and at the extremities. We do nutrition and we do the low tech exercise. Now, all of those modalities can be summed up in a simple sentence: is that we're trying to excite pressure sensitive mechanoreceptors. Okay, so pressure sensitive mechanoreceptors. We want to think about those as a very crude analogy, a little angel sitting on one shoulder. The nociceptors are going to be a little devil sitting on the other shoulder. It's not exactly like that because nothing is all good and nothing is all bad. But for the sake of what we're trying to accomplish here, the analogy works. And what we want to do is we want to stimulate enough of those joint mechanoreceptors and muscle mechanoreceptors that they are going to inhibit the nociceptive activation system. So when we make chiropractic adjustments, the quick thrusting maneuver into an open joint space, sometimes we hear a popping noise. Oh, I love that popping noise. I love that. I could listen to that all day. I have it on continuous playlist on my Spotify. Um, doesn't always. Some of the best adjustments are quiet, but I love that popping noise. When we stretch muscles, when we force the tendons to activate, what we're essentially doing is we are stimulating the joint and muscle mechanoreceptors. The giant angel on one shoulder just keeps growing. And we use that giant angel on that shoulder to shut off the communication from the nociceptors. Now, the primary shutoff level for the nociceptors actually happens at the spinal cord. So if the nociceptors activate in tissue here in my palm, travel through a nerve up to my spinal, up through the nerves up to my spinal cord, from my spinal cord up to my brain, and we're shutting it off at the spinal level, not at the brain level. So that's kind of big. If we think about other modalities that would shut off nociceptive systems, what we're actually doing is dampening down the brain so it's less likely to feel the problem coming up. Doesn't mean the problem went away. It means that we're no longer conscious of, or we're no longer being able to experience or able to deal with the problem coming up because we've blocked our ability to feel it. So if we're heavy on artificial chemistry, I like that, artificial chemistry. we're not some of that artificial chemistry that you get at Burger King over my left shoulder with the full parking lot. That's going to change your internal pH. It's going to activate nociceptive system. Sometimes artificial chemistry comes in a little bottle and it has all the best intentions for therapeutic intent, and it works magnificently, but it creates other problems. And that other problem means that your brain might no longer be able to experience those nociceptors. Your brain will continue to experience those nociceptors, but you won't be able to adapt to it or to fight them off or to block them. And as I said, they're additive. We keep having buildup, we get bigger and bigger problems. So far, so good. Questions, comments, moral outrages from the virtual land? Good. That, my friends, is why I am a natural health guy. I like to use nutritional supplementation. I believe Tracy Stroup is going to talk after me, and she is a nutritionist savant. She is going to tell you things that I can't comprehend. We have people who work here, Alicia in specific. A lot of the Nutritional Frontiers sales reps are very well trained, who will guide you through nutritional protocols to inhibit digestive disorders, to inhibit the sympathetic nervous system, to inhibit the accelerated heart rate, to inhibit liver toxicity. I confine myself to the musculoskeletal stuff. I confine myself to tight muscles. Let's lubricate and maneuver joints. Let's get the tendons and the ligaments to activate. Let's use those tissues as a tool to stimulate that giant angel on my right shoulder to bash down those nociceptors on my left shoulder. You guys cool with that? Now this is my topic, man. I can talk about nociceptive activation, and I can talk about presynaptic inhibition and the trackless sour until, well, I'm not going to get bored. You guys might. But I saw something this morning that I've never I've never talked about before, and I think it's critically important to introduce this. Uh, um, I get Dr. Mercola's newsletter delivered to my email every day, and most days I read it, and some days, well, I'm sorry, I delete it, and I should have read it because it's usually good. And just this morning's newsletter. I mean, I'm looking at this like I was like I'm like in my mind, I'm visualizing this workshop, and we were going to do a lot more of the tall and long in the abdomen, and a lot more deep breathing, and maybe talk about head position and talk about more things that I could do for you in the chiropractic context. But this needed, I literally cut a lot of stuff out of my talk to introduce this literally at 6 o'clock this morning. And in 2019, let me make sure I have this right. The life expectancy in the United States was 78.8 years old. That sounds pretty reasonable. I don't know. I mean, every day we hear about people who live to be in their 90s. Unfortunately, every day we also hear about people who pass prematurely. But 78.8 sounds like a rich life. In 2021, that number had dropped. In a 2-year period, that number had dropped by 2.4 years. Now, I know, like, we're all very well aware that that 2-year period introduced us to a new lethal virus. Uh, um, Many of the people who shrank the life expectancy passed because of the virus, and I'm not gonna. I don't want to talk about the politics of COVID. Uh, um, it's there. It's a fact of life at this point. Let's talk about what we do moving forward. But what Dr. Mercola also talked about, where it was not just COVID, just what is it that's bringing our life expectancy down? Opioids, drug use, the alcoholic liver, depression. People are killing themselves out of despair and loneliness. Now, one could say a lot of that is new to us because of the COVID lockdowns, and we didn't know how to account for this, and that's a fair statement. But it's also a fair statement to say, look, there's a lot going on in the world today, and people don't know where to turn, where to look for help, and they've never felt so isolated before. Now, We were open here during all of COVID. I was seeing patients. Dr. Ross was here for some of that time. If you remember Dr. Honigman, he was here for some of that time. That we saw people, and we had like, it was really kind of awkward because we were one of the few businesses that was really open for business, and we have all of this space, and people. There would be people who would come who didn't necessarily have appointments, but they knew we were open and they just wanted to be around people, and I can relate to that. That's a bet on yourself move. That's, look, I'm getting stir crazy. I need to go be around people. I'm gonna go sit in their waiting room and just sit. That was pretty cool. The program that I did at Pitt, this chiropractic program that they're starting in the fall of 2025. This is all because of the opioid crisis. Like, people who actually know what they're doing have no clue what they're doing. That we talk about opioids and addictive and potentially fatal medication as a painkiller. This is exactly what I'm getting at. This is when we talk about what kind of chemistry you can take that might inhibit your nociceptive activation treatment, your own nociceptive activation systems, and yet cause so many bigger problems down the road. We're throwing our hands up in despair. So Pitt started this program. Like, who deals with pain? Who treats patients in pain? Well, physical therapists and chiropractors. We have the best physical therapy program in the country. They are literally ranked number one in the country. Man, I wish I could send some of that charm over to the Pitt basketball team. But anyhow, uh, um, they don't like chiropractic. They've never endorsed us. They've never wanted chiropractic, but the evidence speaks for itself. If you want to be an evidence based program, you have to look at the evidence and follow what it says. All of the evidence says that, look, chiropractic is highly, highly effective for treating pain. Why? Because we're so good at exciting joint mechanoreceptors, muscle mechanoreceptors, providing our patients with good nutrition to normalize their pH, teaching them how to breathe deeply, maneuvering their rib cage in a way that facilitates deep breathing, helping them to adapt better to tissue destruction and tissue. We do tissue repair. Well, it turns out that as much as they disliked chiropractic, they had to invite us in, and they liked us so much they adopted us and claimed us as their own. It's because of the opioid crisis. Drug use. I don't know. I mean, my heart goes out to people who are at home, despair. They get addicted to something. They're taking too many prescription medications that are too dangerous. I do not want to be on record in any shape or form as saying that we can substitute nutritional supplements for any medication if you take these nutritional supplements that don't take that medication. I do not want to be associated with that statement. I'm making this as clear as possible. Medication and nutrition are two entirely different things. That being said, there's a lot we can do nutritionally to help people mitigate their pain. We can do hands on treatment, we can do nutritional therapeutics, which Tracy will talk about shortly, and we can help to suppress pain and maybe make some of that. Well, why did I get involved with all those drugs and those opioids in the first place? Maybe we can make some of that disappear. That despair of loneliness, that those people came here. They sat there, right where you guys are sitting here today. I mean, we don't know these people. They don't have appointments. All they want to do is be around other people. Can you blame them? They wanted to get out from the loneliness and the despair. The alcoholic liver. I mean, alcoholism is a disease. It's an addiction. It's an illness. If the patient wants, it can be treated the way it should be treated. But as far as regenerating the liver, we live clear. We have three different liver specific formulas in Nutritional Frontiers alone. Not to mention, we talked about the greens to alkalinize the system. That has liver cleansing components to it. We can take steps to help repair. I don't know about reset, but certainly detoxify a liver and help people with some of those problems. So when I read that Mercola article this morning, all I could think about is like, we handle all of this and we don't see nearly enough people. The people who we see, I mean, God love you all. I see so many familiar faces. You guys are my old friends. And today is really one of our busier, more crowded, physically in-present attended days since COVID. Please keep coming back. Please keep showing up for our events. Please continue to make appointments. Bring your friends in. Share like, we got plenty of space left. We'll bring in more chairs. Bring your friends in to come and participate in what we're doing here. It's embarrassing. Like, our nutrition store is literally bigger than any GNC I've ever been in. We have such a wide variety of products to help stimulate so many different organ systems and to help counterbalance so many different uh, uh, physical challenges and symptoms. Uh, um, we have myself and Dr. Ross and I, we when we work with patients, we're trying to get to the same place, but we use a different yellow brick road to get there, which is why he and I work so well together. We have a nutritionist, Alicia, who I know that both Dr. Ross and I are busier than her and have referred a number of patients to her. And I see her working with some of my patients. I'm like, they're having so much fun. I'm like, I'm not an outgoing guy. I'm not a big personality person. Like, we have a quiet time talking in my treatment room. And Alicia's a little bit like, she's high energy. Like, oh my God, did you just steal my patients? Do they even like me anymore? Did you just take over control of these people? Am I still? We have a great team here. We have a great leadership team here. We have room to accommodate more people. We have product that can help with such a wide variety of problems. We have chiropractors who can help with wide variety of problems. In a pre-COVID world, I would have told you we have a phenomenal Rolodex, so that, you come in with something that we haven't seen before, may not necessarily be in our scope. We have somebody for you, though. A lot of people retired. So we're rebuilding that Rolodex. We might be able to help you. I can't promise, but we're working on it. And with that, I got a few minutes left, I see. So I'll just open the floor if there are any questions, comments, additional moral outrages, live and in person, people. Everybody, yes, please.
I'm closing in on 76. I go to the gym pretty much 5 days a week. When do I know that I'm using too much weights? I never do a weight room. It's like, it's easy, maybe 10 or 20 times. And then the foot thing, I started.
Let me cut you off and just redo that for the sake of the people online, and you'll pick back up in a moment. Okay. So the question from the crowd is, this woman is closing in on 174, but she looks a lot more like 67, 68ish. Meet you part way at closing in on 76, right? And she goes to the gym to work out with resistance. That means weights, bands, machines, right? And her concern is, how do I know if I'm using too much? How do I know where I reach that threshold that I'm going to hurt myself? Do I have that right? Okay. Do you want to pick up where you left off, or can I keep rolling?
I decided that if I haven't been there for a day, I would go through 20 or more machines, 10, 20 times. I lightened the load for the one where you sit back and you push back. Like, I used to do 85, and I think maybe that's too hard on my knees, so I reduced it to 70. And I only do 10 or 20 times. I'm not going to burn my muscles. They say, burn your muscles, and that's how you strengthen them. I don't go there.
Okay.
I'm just trying to stay in shape so I can enjoy myself. And I really don't hurt anywhere, but I've been coming here since 2006.
Okay, we just had another drop the microphone moment. This woman who goes to the gym and has She's describing, by anybody's standard, a comprehensive routine with machines against resistance. Uh, uh, Says that she doesn't hurt anywhere, and she believes it's because she's been coming here since 2006, which I also believe. I would like to, I'm not going to take sole credit for her being ache and pain free, but I am going to claim some of that credit. And because I know this person well enough to know that she takes a number of nutritional supplements, and that plays a role. And I know this person well enough to know that she does other things besides go to the gym, which include getting out in nature and going for a walk or a hike from time to time. And that certainly plays a role. And I know we talked about this years ago in a private one on one about posture and breathing. And as I'm looking around the crowd, just kind of watching as people are shoulders back, chest up, long in the abdomen. She's really one of the better people in the group at doing that. So I know there's been some work into this. This did not happen by accident. And yet I very graciously seize some of the credit for her not having aches and pains. Now, as a rule of thumb, when you exercise and you're trying to, whether you're trying to build muscle or activate muscle, or become stronger or maintain the strength that you have, or whichever it might be, you want to think about that exercise period as being a time when you're straining the muscle. Now, if you just want to maintain where you are, you still have to give yourself a mild strain. If you want to grow and you want to become stronger, you got to push yourself, and that's going to be a more intense strain. So, extrapolating from that, one of the keys to good muscle therapy, muscle growth, hypertrophy, exercising at the gym, you got to have recovery. So I certainly don't want to do the same exercise routine or work on the same groups of muscle against time and tension resistance, the same exact thing every single day in a row. I'm thinking like maybe every third day maybe I have three routines, and I'm going to do routine A on day one and routine B on day two and so forth. And maybe I'll take a day four off and I'll go back to routine one. So that's going to build in some recovery time. And the question is, how do I know if I'm overdoing it? How do I know if I'm using too much? Well, the last time you did that exercise, how did you feel afterwards? Do you feel like, wow, I could do one more at the same weight this time? Uh, um, I actually could have changed the pin and I could have done 5 or 10 pounds heavier this time than last time. Do you feel like there has not been a drop off, and there may even be a little bit of a little improvement? And if that's the case, I don't think you're straining yourself, and I don't think you're putting yourself into possible jeopardy. And just yesterday, I was having a conversation with a patient who has AFib and a number of cardiovascular concerns, and the swollen lower legs. And he's telling me that he goes for a walk in his neighborhood. And we talked about gauges along the way. And he says, I have a hard time with this long, gradual hill. I said, well, you know how you feel when you get done with that hill. And you have a certain set of parameters. And some days you get to the top and you're like, hey, that was better today than it was yesterday. And some days you get to the top and it's like, man, I've never struggled like this before. And he's like, yeah, you're right. Of course I'm right. Uh, um, so the gauge is, well, are you starting to have more days where it was never this bad before? When you're working out in the gym and you're moving tension against your muscles over time, like, are you going to have days where, like, I feel invigorated? I was powerful today. This felt even better than yesterday. Or are you going to have days where it's like, oh my God, why did I do this to myself? I should have stayed home. This feels awful. So that's going to be your barometer as to, did you have a regression and it's time to back off, versus I'm doing fine. I'm just going to keep on keeping on. You follow me on that? Okay. So, Professor Stephen Wolf, who's a professor of population health, I don't know what a professor of population health does. I feel like today I might have become a professor of population health. Said in response to this decline in life expectancy, it's like the last 25 years of medical advances have been erased. I got an idea. Let's unerase them and start having some natural health advances. Let's continue to bet on ourselves and see chiropractors and occasionally acupuncturists and massage therapists and nutritionists and eat better and breathe deeper and more efficiently and take all the nutrition that we need and let's at least within our circle, let's try and bring that life expectancy number up a few years. I want to thank you all so much, not just for being here, but for your kind attention, for participating in the workshop, for not just being here, but being present. I've enjoyed having a chance to talk to you guys and having this interaction. So thank you all so much.